Well, let's start. Hello, good morning. Welcome everyone to the first online version of the POLIS Conference, and welcome to this session, Healthy Urban and Transport Planning. We know that transport and urban planning have a very important impact on the health of citizens. Cities designed and with large investment in infrastructure for cars lead to problems such as high air pollution, noise and stress levels, heat island effects, lack of physical activity and green space, and thus to health-related problems and premature mortality. But at the same time, well-planned and managed cities can provide a sustainable, livable, and healthy habitat for large human populations. The question we will address in this session is, how can cities become healthier through better urban and transport planning? So today, we will explore this topic, bringing together the views of experts and city representatives that are implementing measures to accelerate this transition to healthier and more livable cities. But before we start, I would like to introduce you the housekeeping rules. To ask questions during the session, which we encourage you to do so, go to chat and then session. Be careful not to post them in the event chat, otherwise it will be visible for the whole event. It is also very helpful if you note to whom you are addressing the question. To view polls, you have to go to polls and then session. We will see this in a minute. To view who is attending this session, go to People and Session. And to maximize the screen, you can hide the chat or double-click on the presentation or speaker. After the session, we suggest you try the networking function and visit the exhibition area. Regarding the structure, this session is divided into two parts. The speakers will first give their presentation. After each presentation, we will have time for one or two questions in case you have specific questions related to the presentation. And in the second part, we will have a discussion bringing the questions from the audience and between the speakers. So now you can go to the poll, to the session poll, and as you can see, there is a poll already with a question to know more about the background of all the people that are today here in the room. So please complete it so that we can know more about you. And now, with no further delay, I will introduce our distinguished panel of speakers that has joined us today. Mark Nieuwenhuijsen from ISGlobal, who will speak about urban models and health. And then we will hear about the experience of 3 POLIS members implementing a variety of measures and programs to improve health through urban and transport planning. Dorrith Dijkzeul from City of Rotterdam, Stuart Blackadder from Transport for Greater Manchester, Mirthe Dolk, Dutch Ministry of Infrastructure and Water Management. And now, with no further delay, I will introduce the first speaker, who is Mark Nieuwenhuijsen. He is Director of the Urban Planning, Environment and Health Initiative and the Air Pollution and Urban Environment Research Program at ISGlobal, Barcelona, Spain. He is a world-leading expert in environmental exposure assessment, epidemiology, and health impact assessment, with a strong focus and interest on healthy urban living. He has edited several books on these topics and has co-authored more than 450 papers and 35 book chapters. He is currently among the 1% most cited scientists in the world. So, Mark, it's a pleasure to have you here, and the floor is yours.
Many thanks, Maria José. It's a pleasure to be here. Hope you can hear me.
We can hear you.
Thank you. So it's a very short presentation. But yeah, what we're all wanting, I think what we're going towards are the carbon neutral, livable and healthy cities. And I want to address a couple of the points here. As we know, many cities are dominated, unfortunately, by cars. For example, here in Barcelona, this is a picture from Barcelona. We have many cars. Sometimes it seems to be that it's a city for cars rather than for people, even though only 1 out of 4 trips are actually by car. The rest is by active and public transportation. We've estimated that there are almost 3,000 premature deaths due to urban and transport-related exposures in Barcelona, including air pollution, noise, heat island effects, lack of green space, and physical activity. Now, many cities trying to already become healthier in a way. And I think with the coronavirus pandemic, I mean, this has been sped up a little bit. What we've seen is, I'll show you later some of the measures that the cities have taken, but also different practices in a way that people are more teleworking. What I think to some extent is good. I mean, it reduces mobility in the city. Unfortunately, we have also seen more online buying, what is not so good, what I believe, for cities. And unfortunately, also we see less use of public transport, what is not good. But the more positive aspects, I think, what we've seen in particular in relation, because the best prevention is the distancing measures, is that cities are taking a larger effort to keep the car out. I mean, for example, Paris has been in the news for this. London is trying to make many parts in London car-free. Milan is increasing the cycling lanes and reducing car use. And, just even talking about a European cycling revolution because of the increased sales of bicycles and use of bicycles. So we've seen some more positive changes, and I think we need to have this reinforced, I mean, these changes, and think about how we could use better the urban space that we have, because it's very precious. I mean, unfortunately, it's dominated, as what I said, by cars often, and we need to make it actually more that we reduce the car use and go more to active and public transportation, and at the same time also greening. This is not only good for health, but also for sustainability and livability in cities. So I think that the key for this is to look at our urban models, how we can change them and improve them. I would like to start here with Barcelona. I mean, many of you probably are familiar with I've been to Barcelona, seen this kind of structure, what we have, this grid system. And Barcelona is trying to introduce a new use of this space through the super block model. So on the left side, what we can see is the current model, grid system, motorized traffic going up and down, left and right. The idea is to, in a block of 9, to cut the junctions and only make it accessible to for active transport, walking and cycling, and also green this particular area. The idea is to introduce 500 super blocks in Barcelona in the long term, or that's the original plan, but we've only at number 3, and this is one of the examples of the super block, Sant Antoni, where you see what it was above and what is below. Now, introducing the super blocks, if you would do it for the whole of Barcelona, has many benefits. I mean, it would reduce car use by about 20%, has been predicted, also reduce air pollution, noise, increase green space, and reduce surface temperatures. And we've estimated, for example, that this would prevent 700 deaths each year in Barcelona. The greatest benefits come from the reduction of air pollution, followed by noise, heat, and increasing green spaces. And then physical activity, we don't see many benefits here because we don't have good numbers, but probably the benefits are larger. So you can see that, changing how we use the space in Barcelona would have great benefits on health, and of course at the same time also on sustainability issues and livability issues for the city. Another urban model that's been promoted is the 15-minute city, particularly in Paris through Carlos Moreno, who came up with this. Here the idea is that everyone would live within 50 minutes of their work, school, shop, or other events. So everything is fairly close to you, reducing again mobility. I think this has great advantages, but also requires a major rethink where people live in the city. I mean, at the moment we have segregation by social economic status with richer and poorer areas, but we need to rethink about this, because here it implies also that everyone would live together in the same area, perhaps when we go back to the Middle Ages where rich and poor were living together. The other model is car-free cities. I've written about this before. Here the idea is to take the car away altogether. Hamburg says that they're going to be car-free by 2034, and other cities, I mean, they've been trying at least to do the city center and have also some plans for doing this. Do you think it's possible? I think it is. I mean, for example, if you go to Vauban, an area in Freiburg, I mean, it's car-free with sustainable housing, lots of green space. All these different elements come together, what makes it also more carbon neutral, livable, and also healthy for people there. Of course, what we know is what we need to do is work together. I'm coming from a public health background. I know what are healthier options, but I can't change anything. That's why I would like to work with urban and transport planners, but also with people from the education section. I mean, too often kids are being taken to school by car, for example, that they shouldn't be taken to school by car. And so we need to make some changes, and we need to come together, think about, how we get the different sectors involved, and also use systemic approaches that we don't only address health of the citizens, but also sustainability issues, livability issues, and many different exposures then. I just published a little book on this. So it's a bundle of different posts, how the COVID pandemic actually is influencing the transformation of the city. And the idea of making cities more carbon neutral, livable, and healthy, I've described earlier this year in an article. I'm happy to send it to you, but it's also open access and you can get to it. Many thanks for listening. Hopefully it's given you some idea. I'm happy to take some questions.
Thanks a lot, Mark, for this very clear presentation that sets the scene perfectly for the topic today. I have shared a link also to the article. Claudia has shared it, to the article you mentioned. Thanks, Claudia. And let's see if anyone has any questions for Mark. I see there's one question from Ron Bonneau. Mark, was the superblock concept a high-level political decision, or did it originate with the transportation agency?
Yes. Yeah, so initially it was proposed by Salvador Rueda, who works at an agency associated with the Ajuntament. And he proposed it, and that idea wasn't completely taken over. I mean, he's not working with the city council anymore. But the city council took over some of the ideas. Now, I must say that they haven't, with the recent implementation, haven't taken over the full ideas, and they're talking more about ejes verdes, what is not the full implementation of the super ES, because initially there was some resistance from citizens that were not enough involved in the whole process. So what you see now in Barcelona, that there is this new plan that's just been approved, and they're asking for, in a competition, for how to fill this in, just to implement a part of the superblocks, of the superblock idea within Barcelona. One of the big problems was that people didn't want to be outside the superblock. Everyone wanted to be inside. And so to have this clear separation of inside and outside created some conflicts, and they're trying to avoid that with the new design.
Mm-hmm. Great, thank you. There's also another question. Was taking parking away a problem?
I don't think it was a great problem, because a lot of the parking is under the buildings in Barcelona, so there is not so much street parking as such. It's actually fairly limited, but yes, always when you take parking away, it's a bit of an issue. Everyone, I think for some reason, car drivers think that they have a God-given right to the street, and they should be able to park and to drive. And when you take something away from people, it always creates a bit of resentment, I think. But the great majority of parking is underground. The city council is taking a lot of parking away to so that people are not tempted to come into the city by car. So I'm sure we're going to hear more about this.
Thank you very much, Mark. Don't worry, because we will have later more time for discussions, so the rest of the participants will also have chance to ask later more questions. I would like to go to the polls again, poll session, and we have made another poll, which is to ask you about which are, in your opinion, the most relevant strategies to improve public health through urban and transport planning. So if you could answer this poll, it will help us also guide the discussion later. And now, well, we will go to our next presentations. We will hear from 3 police members to see how they are implementing measures and programs to actually make the link between urban mobility and health. And the first presentation is from Dorrith Dijkzeul, Strategic Advisor in Mobility and Urban Development at City of Rotterdam. Dorrith is an urban designer and has been working during her professional career in the field of mobility and spatial planning, first for the National Department of Infrastructure and Water, and then for the City of Rotterdam. So Dorrith, it's a pleasure to have you. The floor is yours.
Yes, thank you. I'm going to share my screen. Okay, can you see my presentation?
Yes, perfectly.
Okay, well, before I start my official presentation, I want to share this little video with you. This is my sister and my nephew, Vic. And Vic is 3 years old, and just last weekend he learned how to ride his bike by himself for the first time. And actually, this is a milestone for every child in the Netherlands. For us, cycling your bike and having the freedom to go wherever you want, it's like a way of life. So when this is such a way of life for everyone in the Netherlands, why do we use our streets like this? Why do we design our system from the perspective of cars? Well, let's turn this around. And let's transform the way we look at our mobility. More space for pedestrians, cyclists, and public transport. And that's what we call the Rotterdam Mobility Approach. The Rotterdam Mobility Approach is a plan that marks a turning point in the way that we use our public space and our mobility system to make room for healthy, clean, and smart modes of transport. So why did we decide on this new approach? Well, as a city, we are facing 4 major urban challenges. The first urban challenge is growth and expanding population. Rotterdam's population is expanding rapidly. We will gain actually an additional 50,000 new homes up to 2040. And still we want to keep our city compact and accessible. So we really need to make smart choices in the way that we use our available space. Secondly, the environment. Rotterdam's air quality is actually not up to the European standards for air quality. And also we have a big target to reduce the CO2 emissions. So this means that we have to reduce the emissions by traffic, cars and trucks drastically. In order to reduce the traffic emissions. Third, we need to add much more green public space. We have decided to add 20 hectares of green space in the coming 3 years. And for this, we need space, we need room, and choices in the traffic system can provide that room. And number 4, we want to make mobility more inclusive so that everyone has multiple choices of transport available, even in the outer areas of the city. So for our plan, we've done extensive analysis. And the analysis clearly shows that the mobility transition has been going on in the city for years, actually, already. The number of movements by bicycle and public transport has been increasing steadily and gradually, and the car use is actually not increasing. And also the analysis shows us that many times that people use their car, they use it for very short rides or super short rides. So what if we can encourage these people that use their car for the short rides to use their bicycle, use public transport? Because it would leave so much space that we can use for attractive green areas. But in order to do that and to seduce these people to use their bicycle instead of their car for a short ride, we really have to give the space for the bicycles and public transport, give them more space on the streets. So again, the main principle for our approach is more room for pedestrians, cyclists, and public transport. And for this, we've made a plan for the city, starting from the center to the outside. And we call this our perspective for 2030. And this perspective contains many projects and actions for the coming years. And part of it is that we will guide the traffic differently through the city. So destination traffic can still access everywhere, but car traffic that's only crossing the city will be distributed to the main roads. But the big game changer for this new approach will be the transformation of two of the most important places in the city, the Hofplein and the Blaak Boulevard. And right now, these spaces, they take up a lot of space and they accommodate a lot of cars. And many of those cars don't even have a purpose in the city center. So there's a great opportunity to turn it around and not make it a system designed for cars, but make it a system designed for the people. And these plans are going to be realized in the coming years. And also on many streets in Rotterdam right now, we see a large variety of users with different speeds. And this leads to conflicts and dangerous situations, especially in the older parts of the city where the space is scarce. So we've come with a plan to redistribute the traffic, and we will transform road profiles with speed classification. So we distribute by speed and not by type of vehicle. And this gives a much more safety, but it also leaves room for new ways of transport, like speed pedelecs or cargo bikes. But how are we going to implement this transformation? Well, we are going to start, or we already started, with doing experiments. So temporary experiments to test this approach and test new situations. And last year we've done 5 experiments. The first experiment that we did was the mobility challenge Hoogkwartier. And here we challenged 40 inhabitants of the neighborhood Hoogkwartier. And they agreed to swap their cars, their own cars, for a mobility arrangement of car sharing and public transport for 2 months. And the free parking spaces from their own cars were transformed into attractive green areas. And also we created more room for the local shops and restaurants by temporarily making the street a one-way street. A second experiment that we did was the Erasmus Bridge experiment. The Erasmus Bridge is the busiest corridor for cyclists in the city, with about 14,000 cyclists daily. And here we actually have a problem of cyclist traffic jams. And especially during times of COVID, it was important to give more space to the cyclists here. So we doubled the space temporarily for cyclists and reduced the space for cars. And a third experiment that we did, which is actually inspired by the Barcelona example of the superblocks that Mark just told us about. It is the squares of Eendrachtsplein and Kruisplein. And here we created a temporary park, and we improved crossings for pedestrians, and we blocked the access for cars. And we wanted to see and test if we could change the circulation of cars and make the area prettier, safer, and healthier. So these experiments form a first step in a long-term strategy of the transformation of the city and of the transformation of our perspective. So let's turn it around. And that is what we call the Rotterdam Mobility Approach. Thank you for your attention.
Thank you very much, Dorrith. Thanks a lot for your presentation. We see there's a question from Natasha Claes. She asks, how do you ensure livability for elderly people living in cities who are often non-mobile?
Yes, that's a very important question, of course. When we made these plans and we presented them to the people of the city, that was a question that everyone asked. So how does my grandmother, how can she still have access everywhere? So we are not blocking cars. You can still access cars with your car to most of the areas, but we really want to seduce the people that don't need their car on daily basis to use other modes of transport, but still wherever you live you can get there by car. But also we are really thinking about making, especially around, for example, the people the elderly houses, we want to make it more accessible for pedestrians. So improve the routing from residential areas to shopping areas for pedestrians. And our vision for pedestrians has actually been made a month ago, and it also has the philosophy of from 8 till 88. So for all the ages, make sure that the routing for pedestrians is upgraded.
Mm-hmm. Thank you very much. We have another question coming up. It's from Lisa Marie Brunner, and she says, how did the citizens react to the pop-up park, and is it permanent now?
Yeah. So the pop-up park that I showed in the last example, we had different reactions. Of course, many people who are used to driving their car there, they were quite mad. It also, well, they really had to get used to the situation. But well, the residents of the area were very happy. Visitors were very happy. We did a lot of analysis. We did a lot of inquiries during the experiment. So right now it is back to the old situation, unfortunately. But as soon as we have the money and there is like a big reconstruction planned, we will turn it probably make it a definite situation. And the first example that I showed of the city or the street that is a one-way street that we tested as a one-way street, that is actually we've made permanent now. So that was received very well.
Okay, so you're in the process of making them permanent. Mm-hmm.
Yeah.
There's another question from Sabrina Schimmel. Did the citizens who swapped their cars for car sharing change their mobility behavior long term? Also another question on the long term.
Yeah. Well, right now we're the experiment is almost a year ago. And yeah, some of the people, they still use the mobility arrangement, but also many people, well, they got back their car and they got back to their old habits. So from this that we've learned that it takes a lot of energy to get people to change their situation, especially when their lives don't have other compelling events, when they're not moving or switching jobs or something like that. But what we do know is that many people who were maybe considering getting a second car or getting a car, they still use the mobility arrangement instead of buying their second car or buying their first car. But yeah, right now we're still monitoring the situation.
Okay, great. Thanks a lot. There are a couple more questions, but we will address them later in the discussions as we have now to go to our next speaker. So see you later in the panel.
Yep.
And we will now go to the next POLIS member, Transport for Greater Manchester, so we can learn more about their approach. Stuart Blackadder has a background in urban regeneration and education and works in the Logistics and Environment Department at Transport for Greater Manchester, the local transport authority for 2.8 million people in the northwest of England. He is primarily responsible for local air quality management and developing stronger links with the health sector. Stuart, the floor is yours.
Hi, yeah. Can you hear me?
Yes.
Yeah, hi everyone. Thank you, Maria. I'm Stuart from TfGM. TfGM, Transport for Greater Manchester, it delivers the policy, the transport policy set by the Mayor of Greater Manchester in the city region of Greater Manchester in the northwest of England. Today I'm going to be talking about the processes in constructing a city system plan, a cross-sectoral decarbonisation strategy between health and transport. So obviously the challenge that we're facing is achieving these carbon reduction targets and many, many more challenges which have been mentioned already. But in Greater Manchester, that target is to be zero carbon by 2038. And TfGM has a sustainable urban mobility plan, the 2040 strategy, which is a very strong foundation, but it can be enhanced in several ways to tie it in with that decarbonisation goal. We can develop long-term transition pathways and implementation strategies as we have with a 5-year environment plan. We can strengthen partnerships and consult with key stakeholders across the city region. And we can strengthen our relationships, our links with all of the different sectors across Greater Manchester. There is a strong need for that strengthened relationship because travel is a derived demand. So retail, tourism, health and education, most passenger and freight transport demand is coming from these other sectors. And these sectors are rarely accounting for the costs, the environmental costs and social costs of their transport and travel activity. So the transport sector needs to engage and make sure that message is very clear and the relationship must be strengthened. Also, electrification is not going to completely solve the problem by itself. We need to work together to ensure that the total distance travelled is reduced overall. So I'll give you one example in the health sector, in the NHS, and this is from the Delivering a Net Zero NHS strategy, which was published this year. You can see that projected emissions, projected reductions in emissions are going to be covered quite significantly by electrification. That's those 2 green bars on the right, but there's going to be a variety of other measures which are required, such as active travel, preventative measures, and improving the digital care pathway within the NHS. And in order to improve on these measures, much greater integration between the 2 sectors is required. So Enter Some Plus, it's a 3-year Horizon 2020 framework funded project, 16 European partners across 9 countries, which aims to address cross-sectoral mobility related challenges and exploit new opportunities through co-created city laboratories. So you can see there, we're in good company with some other great cities who are working on other impactful projects, and we're focusing on developing the city systems plan. The process that we're undertaking is understanding the baseline through an evidence base. It's worth mentioning we're sort of at the end of the 1st year, beginning of the 2nd year now, where we're in between phase 1 and phase 2 of this approach. And phase 2 is starting to work more significantly with the health sector and set up the right instruments for that exchange. And phase 3 will be delivering the interventions that we designed together through trials and other pilots and things like that, and seeing how that goes. So let's go through that in a bit more detail. The evidence base, we've put it together by looking at local transport strategies, the local health strategies of the Greater Manchester Health and Social Care Partnership. It's been put together with interviews and other data sets, such as the health outcomes from Travel Tool, which is an extremely helpful data tool developed by NHS England. And it basically acts as a good starting point where we can understand the existing relationship. And what we found in producing this evidence base is that our relationship, the transport sector's relationship with the NHS is fairly traditional. It's mostly looking at opportunities around active lifestyles so that we can get the dual positive benefits of healthier populations and reduced emissions from travel. There's also a lot of work around reducing the NHS's business emissions. And there's also been some work around consolidating Greater Manchester Health and Social Care Partnerships supply chain for a greener carbon footprint in procurement. So when we are working with the health sector, yes, we want to continue covering those themes around improving public transport for staff, for patients, and improving walking and cycling facilities for them to encourage greater sustainable travel to the NHS facilities. And we want to continue our relationship working around helping them meet clean air zone targets and cleaning their vehicle fleets. But we want to expand the conversation with the health sector so that it covers even more than that. And that is central to that concept of derived transport demand. We need to start looking at some non-transport measures as well and introducing these into the conversations that we're having with the health sector. And the kind of things we're talking about there are the likes of increasing uptake of the home deliveries of prescription to reduce a dual journey by a patient, say, who's going to the pharmacy to pick up his prescription. Or even slightly more innovative, introducing hardware to a patient's home, like a dialysis machine, so that they don't have to travel to a facility which could be several miles away and only accessible by car. Also improving the digital platform, as I mentioned. We've seen a huge increase in the number of appointments being made online during this crisis. And that's something that we'd like to explore and see what opportunities lie there. And the golden egg of all of this is trying to make health facilities more localized and accessible for people within a community, so they're not having to travel vast distances, often with the only option available to them being a private car journey. So yes, all sorts of measures, not necessarily always transport related, sometimes operations level related. And that's why working out who we need to engage with in the health sector is so vital. And the process that we are undertaking, it's been designed by our project partners, European Integrated Projects. It revolves around the setting up of a city integrator group, which will meet frequently. It's the decision makers from transport and health organizations, and they will devise this decarbonisation strategy. We're at the early stages of this now, and that will be supplemented with evidence and some intelligence from both the health and transport industries, and also frequent consultation with the local population, with the general public, to make sure that everybody's needs are considered, such as, for example, the elderly population. It will look a bit like this in a bit more detail. We've got also representation, ideally from the mayor's office, so that it's a really balanced group achieving both of our mutual aims. As you can see, this is an outline of the process. I hope I'll be able to share some successes with you in the future. But any examples of some sort of similar health transport collaboration, I'd be thrilled to hear from you. So please feel free to email me. And thank you very much. That's all from me.
Thanks a lot, Stuart. And thanks for highlighting the importance of a cross-sectoral approach to harness the potential of the collaboration between different departments and governance layers. So this is something also Mark mentioned at the beginning in his presentation. So very interesting project as well. And let's take some questions. There's a question saying, if the transport sector needs to make its voice louder to the other sectors, how does it do that? Do you go to the public or the other sectors?
Well, ideally through mapping who is necessary to contact in that situation. So obviously it's not only going to stop with the health sector, it's going to go to all of those other ones I mentioned. And it will take identifying who is the key consultation partner and speaking with them initially in sort of private forum, but then also using the power of the voice of the general public to back up the transport sector's arguments as well, so that it carries more weight. I think that balanced approach is important.
Mm-hmm. Okay, thank you very much. I also have a question because you said that exploring the links between transport and health can bring to the surface otherwise neglected interventions. Are you already seeing any benefits from the engagement between the health and the transport for professionals? Have you already have some results?
Well, as I said, we are still at quite an early stage, but because of the COVID-19 pandemic, I think there's been this relationship has been working in a way that maybe it wouldn't have worked without it. So we are seeing enormous uptake of online appointments in parts of the city region, and that's one way which I think, if we can look at that as an example, it will really bring home the message that the two can work together and exploit that opportunity across the city region as a whole and across the country.
Okay, thank you very much. Thank you very much, Stuart. So see you later in the panel as well. In the meanwhile, I would like to remind people that haven't replied to the 2 polls that are active currently, if you can please do so. And now our next speaker is Mirthe Dolk. Mirthe works for the CycleOn program, an initiative of the Dutch Ministry of Infrastructure and Water Management. The aim of CycleOn is to make elderly cyclists aware of bicycle road safety concerns and to increase levels of mobility and vitality. Safe cycling until you turn 100. So thank you, Mirthe.
Yes, thank you very much.
Thank you.
Hello to all, good afternoon. Today I'm going to share something about the CycleOn program and how we encourage elderly people to keep on cycling. Unlike the other presentations, my presentation about the CycleOn program is very focused on behavioral change. And it's been developed because research showed that the number of seniors who are seriously injured has increased a lot since the early 2000s. Overall, the number of bicycle crashes has decreased, but specifically the older age groups encounter more bicycle crashes. On the contrary, we see that they cycle a lot more and they cycle longer, and that's partly because of the use of e-bikes. So they cycle more kilometers and more often. But when they encounter an accident, many of the elderly people stop cycling altogether. And it's important for them to keep on cycling because of health reasons, but also self-reliance and social engagement. So riding their bikes is not only a mode of transportation, but it's also beneficial for their self-reliance to keep seeing their friends and family and to not be dependent on others. And because they are more involved in bicycle crashes, we looked at the reasons why, and the common reason is that they're unaware of the dangers they encounter on the road, and they're not easy. They don't change their behavior easily. They do not intend to adjust their behavior. The next slide. Our Minister van Nieuwenhuijsen, she wants to keep the seniors on bikes, but in a safer way. But how do we do that? We see that the interest in bicycle training is falling, so we need to find another way to educate these elderly people. And that's why we created a new program, the CycleOn program, that's based on research and pilots. And the main conclusions are that they're not aware of their own safety concerns. They do not have an interest in bicycle safety programs, but they do show a huge interest in themes that touch them, such as self-reliance, loneliness, and health. So it's an ongoing program, is an ongoing project we now have initiated by the Ministry of Infrastructure and Water Management. And it's also part of the National Road Safety Action Plan in the Netherlands. So it's been an initiative of the ministry, but we do not do this on our own. We need the cooperation of provinces, transport regions, and municipalities to keep these elderly people on their bikes. We also work together with a lot of national partners, Beter Out, BOVA, the Dutch Cycling Association, and also the Ministry of Health, Welfare and Sport, and many others. The ambition is to make elderly cyclists aware of the road safety concerns, and the best way to do that is via their own trusted networks. So the provinces and municipalities and local health authorities are all part of our network. And this way we can reduce the number of bicycle crashes among the elderly cyclists, while simultaneously increasing their levels of mobility and vitality. Well, I already mentioned this new approach, and the most important aspect of it is the local interpretation. It has to be close to home. So CycleOn events are woven into existing activities, such as a gym class or a bike ride. This way, we can teach the elderly people how to safely ride their bike, but it's not extra work for the professionals. So we combine the existing activities with an educational plus. We also created a digital platform for our professional network, where we share our interventions, measures, knowledge and support. And this way we hope to take away some of the work for them. And this is, in a nutshell, the way we work together. And connecting and working together is really at the core of CycleOn, both in terms of government layers, so we have the national, regional and local levels, as in terms of policy domains. So we see that the road safety domain works together with the healthcare domain, with the sports sector, physical activities, and this way we create a network in which the cyclist is at the center, and that's a very important asset of the success of CycleOn. But we also encourage local partners, such as the bicycle repair shop, or a local practitioner, a sports association, a GP, to keep motivating the cyclists to keep on cycling and to give them insights in how to do that in a safe way. CycleOn started in 2018, and we are now active in 10 out of 12 provinces, and more than 130 municipalities have joined the CycleOn program. That's a lot, but we're still not there. For next year, we would like all provinces to be a CycleOn partner and to have 50% of the Dutch municipalities involved. And we also want to keep on expanding the joint approach of road safety, health, well-being, sports, etc. We've also learned a lot on the way. Most important takeaways are that cycling is fun. The CycleOn program has a very positive approach. We want the elderly cyclists to enjoy all the activities, and that way we can also teach them about road safety. The early adopters have been very important for the success of CycleOn. We started with a small group of people who were very eager to make change, and this group of frontrunners have also played an exemplary role for others. And lastly, small steps. We started with a small group and a very limited scope, and now 2 years later we have made a huge progress. Cycling during a pandemic has been interesting, especially for the elderly target group. The main message here was stay at home, so we couldn't organize activities outside. And thus we have moved the attention to online tools and information, so seniors could practice at home and keep fit for cycling, preparing them for cycling after the lockdown. And now we see that our partners are slowly organizing activities again, but in a very limited scale. And I would like to end with a movie of one of our CycleOn heroes, Mr. Brushen. He is 96 years old and a true hero of our program. So I'll show that. So thank you very much for your attention. And if you want to know more, just email me. We'll get in touch.
Thank you very much, Mirthe. It was very nice seeing the video. We could see it perfectly also with the subtitles, so that was great. Thank you very much. I think it's an interesting program and also might be of interest for other cities, as it can be a situation other cities can have or may have in the future. So very interesting.
Yeah.
We are having now also some questions. Gilles Bailey, he asks, have you found very specific infrastructure needs for older cyclists? For example, intersection design, re-access to rail stations, parking. How is this perhaps specifically different from more typical cyclists?
Yeah, there are some things that are more difficult for the elder cyclists. And we are at the moment, we are exploring the possibility to create what we call relaxed routes. So that are easygoing routes with a lot less of those intersection designs or, small bumps in the road. And these routes are specifically targeted at the elder group, so they can easily ride their bikes. So we see that there are some special needs, but the program itself doesn't has a focus on infrastructure. It's purely based on behavioral change.
Mm-hmm. Thank you very much. Mm-hmm. Susan Rivers says, how did you find these enthusiastic early adopters? Did they come to you or did you specifically have to look for them?
Well, we found them pretty quickly, and that was one of the nice aspects of the program, because there is a lot of enthusiasm in the mobility world and the health sector together. And it's all about networks. And what we see is that on a local level, these networks are becoming more and more important because they can reach the elder cyclists at the quickest. And we used those local networks on a small scale and expanded it further and further and further. But we started with a very small group, and they came to us and they saw the problem, and we saw the same thing, and we started working from there. So.
Thank you very much. Another question from Ron Bono. Are there large concentrations of the elderly where you can target the elderly bike program?
Well, we are dependent on our local partners, so we deliver our information, our toolkit, the communication materials, but the implementation of the program lies with the local partners. So they are the closest to the elders. So we see, for example, that the local library works together with a sports coach, and they organize an activity where they bike together, and they also get a lecture about safe cycling. So large concentrations, yes, there is a very big concentration of elderly people, but they're spread out over the country, and for the implementation, we are working together with a lot of people.
Great, thanks a lot. In relation to this, I would also like to mention that just last week, the World Health Organization published the guidelines on physical activity and sedentary behavior, that we could also post the link there. It might be of interest as well for some people. Well, okay, thank you very much, Mirthe. So now the time has come for discussion, and the floor is open for your questions. So don't be shy, and please post your questions in the chat box. I will first go to see the results of the polls. I will check them in case some of you cannot see them. But we have, regarding the people that are here today, we have, based on the people that have replied the poll, 46% of local or regional authorities. We have 13% consultancy, 8% NGOs or international organizations, 8% governmental organizations or ministries, some representation as well of the university or research institutes, 50%, and industry, 8% as well. And I would like to ask the other speakers also to share their screens, to share their video and audio, so they can join me here in the stage. Thank you.
We're back.
Welcome again. Okay, so I'm not sure if everyone can see it, but regarding this question about, I asked the audience to select from the list the intervention policies and actions which they think are most effective in creating healthier cities. So far, we have a winner, which is reducing car dependency and moving towards public and active transportation, which is, well, it's 40%, or I think right now it's the most relevant. So I would like to ask Dorrith, for example, as you have been working in your city to reduce the dependency and move to public and active transportation, what are the barriers you have faced in implementing such measures? Could you elaborate a bit on your experience from the city of Rotterdam?
Yeah, so what we've noticed is that the city of Rotterdam actually is a modern city. It's not like other cities in the Netherlands, Amsterdam, the capital, or Utrecht, that have very old city centers. Rotterdam has a modern city center with a lot of space, and it was created and actually rebuilt after the Second World War with big boulevards, and it was all designed from the perspective of cars. So in the perception of people, Rotterdam is a car city, and it is very hard to change that mindset. But on the other hand, all the space is available. So, well, again, like I said in my presentation, it's really a matter of turning it around also in your head. And well, what we've noticed is, for example, also in our politics, that well, many people are struggling with making that change in their heads, while the space is available and while the opportunity is there, because people only use their car for short rides. So yeah, so the big challenge is to change the way people think about it. But I think we have to show them and actually really show what you can do with the space. So instead of using it for cars, use it for green. And with the experiments that we did, we can really pinpoint to people what we give back instead of asphalt and cars.
Mm-hmm. Okay, thank you very much. There are also two questions for you in the chat, so I will take the opportunity and ask them to you. One, it says, very good, it's from Vincent Meyers, very good idea to make road lanes on the criterion of vehicle speeds, but do you address the problem that speeds of electric bicycles is increasing variably? How do you cope with this?
Yeah, I read the question. I didn't really understand it, like increase variably, but well, of course we have electric bicycles that are allowed to go more than 30 kilometers per hour. And we have electric bicycles that go slower, like around 20 kilometers per hour. So these two types of electric bicycles, right now, we're really struggling with where to put them on the street profile. And this leads to dangerous situations. So when we distribute by speed, we can have the speed pedelec with the cars, for example, and the slower electric bikes together with the regular bikes. And yeah, that will give less conflicts.
Mm-hmm. Okay, thank you. I guess it was on that direction, but if not, Vincent can ask for more clarifications in the chat. And then there's another question from Lucia Cristea. Thank you for the presentation, Dorrith. And it says, seducing, did you analyze the impact of the method? Who is the most likely to change the mobility behavior?
Yeah, so seducing, I would call it seducing and facilitating. I don't know if that is an actual word, but We have actually, for the last 10 years, we have done this already. So we've had many measures in the city that give more space to cyclists. So we've really enhanced our cycle infrastructure. So on the side of infrastructure, we've done a lot of investments, and we see we see the increase of cycle rides. And on the other hand, we've invested a lot in behavior and in trying to get people to use their bicycle. For example, people with another Dutch background, we've had a lot of programs to try to get them to cycle and learn to cycle. So we've invested in infrastructure and we've invested in behavior. So that's the way we're trying to seduce them. And well, the results show that investing in that gives us the result that like the upgoing trend.
Thank you very much, Dorrith. We have here another question from Laszlo Sándor-Kenernyi, who is the chair of the working group on active travel in POLIS. He says, hi all, we've heard Lucy Saunders in the plenary mentioning their careful communication approach with healthy streets and to focus on needs that people are really interested in. Mirthe mentioned the same with targeting elderly cyclists. What would be the main topics in your cities? What should we focus on while talking to people, trying to touch on the real demand? So maybe this is a question for you, Mirthe, if you would like to elaborate a bit on how was your getting in touch with elderly cyclists in your case.
Yeah. Yeah, because what we saw in our research is that you can tell an elderly cyclist that he has to cycle safely, but if you tell him like that, they're not very interested in your talk. What you can tell them is that if they ride their bike safely, they can cycle longer, that they are not dependent on others for example, their groceries or their social activities. They don't need to call a taxi for every move they make in the city. So we took that information and we used that as a way to well, how we do it is we look at activities that elderly show up to, such as a local meeting in their neighborhood, and we invite speakers to that meeting where they tell something about safe cycling. Or a member of the local cycling authority comes to the library and shows them how to adjust their bike so they can ride on their bike safely. So it's all about combining different aspects of their daily lives and trying to seduce them to think about their safety behavior. And that way we keep it fun because they like seeing other cyclists, they like cycling together, but we also give them information on how to do that. And that's the beauty and the charm of CycleOn. It's a fun first, information second.
Thank you very much, Mirthe. Again, the word seducing came up again. And Mark, before, Laszlo was mentioning the interesting insights from the plenary before, but Mark, you were also mentioning before that you found that some of the views were very interesting and also linked to our session. Would you like to give us our views on that?
I think what comes up, I mean, for a lot of things, I mean, I think when I was talking about it, what with Lucy, what she was saying about the healthy streets example, I mean, I think it's a wonderful example. You know, you have also the low traffic neighborhoods. I mean, these are how to make the streets healthier in a way, and, you know, people can enjoy the streets more. And I think that these are very important examples because we know that we need to get the cars out of the street. I mean, they're taking up too much space in a way. I mean, that can be used in a much better way. You know, you want to have people walking, cycling, or taking public transport rather than having their car. I mean, I think the problem is that still so many people are so attached to their cars. I mean, I must say less so with the younger generation. It's more still the older generation And, you know, they want to have the car parked in their street. They want to have access to it. Although even most of the time, they only use it a few % of their time. I mean, cars are parked the great majority of their time, so you don't use it. I mean, so what you want to get people in their mind, I think Dorrith mentioned this, you need to change people's mindset. And I think that's extremely important. And that's also where the healthy street example comes back with on the low traffic neighborhood, is that we need to reimagine how we use streets. I mean, people think that streets are there for cars to drive, and that's not the case. I mean, it's public space that is there for everyone to use. And you need to emphasize also, what are the advantages of getting out of the car and starting to cycle? I mean, Mirthe was talking about it there as well, what it's for the elderly, what's extremely important, because, you know, we know physical activity is extremely important, particularly for over 50s. You need to stay active. And so we need to bring out what are these benefits that they have for people. I mean, people don't want to get ill. I mean, unfortunately, what we see at the moment is a lot of people live longer, but they live longer with disease. I mean, we want to prevent disease. And so I think we need to get these kind of messages out, that it's much better if you have a short journey to walk or cycle rather than step in the car, even though the car is faster. But, you know, think about other things as well.
Mm-hmm. Totally. Thank you, Mark. Yes. And I'm going back now to our poll to see also what our participants think. Indeed, also space reallocation to promote active travel, as you were mentioning right now, is also highlighted as a relevant strategy. And we are also seeing that another of the topics is improving collaboration, leadership, and investment. It's also quite it's also highlighted. So I would like to turn to you, Stuart, regarding your experience in transport for Greater Manchester and your involvement in the Sun Plus project. How do you think improving collaboration, leadership, and investment can also promote healthier and more livable cities?
Well, we each individually can't take this on ourselves by each individual sector. It's important that we understand who is responsible for the trips that we're seeing around our cities. And in a lot of ways, that picture is just completely blurred, understandably. We interpret data sets in specific ways. We're not viewing them in a systemic complicated network as we should be. And the more research we do into where these trips are derived from and who can therefore be responsible for mitigating the impact of those trips, the better. So the only real way that we can go about doing that is to strengthen the platforms through which these different sectors work. Mm-hmm. Try and move away from a system where silo working is supreme, and see what effects can be derived in that way. So I think Sun Plus has a good start with regard to this, and I would, as I said, I'd love to hear from other examples where a systemic approach has been taken.
Mm-hmm. Yes, you're invited to the participants. If someone wants to share also some experience, you could also put it in the chat and we can invite you to join the stage as well. That's a possibility. Okay, thank you very much, Stuart.
Maria, can I say something about this? Because I think it's an interesting thing what I heard also in the main session what Lucy Saunders was saying, you know, about leadership. I mean, do the city leaders, I mean, do they actually cycle themselves around or walk around? I mean, do they experience the city? I mean, Steve was saying that often this is not the case, and it's important for our city leaders also to experience what you want to get. I mean, you know, get them to cycle, get them to walk, get them to use public transport, so they know what it feels like and how it can be improved. I think that was a nice message what you mentioned there, and I think this comes back to leadership again, that you need to form part of the city.
Okay. from the other cities in the panel, what are your views on this or your experience? Dorrith, go ahead. Thank you.
Yeah, well, actually, our deputy mayor, she cycles everywhere. She even is an early adapter in the way that she has not, hasn't got her own bicycle, but she has a swap bicycle, which is a concept where you like lease a bicycle, and it's very it really actually helps setting the mind on the opportunities for the city from the perspective of a cyclist.
Mm-hmm. That's good. We have in the meanwhile another question in the chat from Mahfuzur Rahman. Electric bicycle in short distance is okay, but why not paddling cycle? It will keep our body fit and will help immune system. So what do you think? And what is your strategy about both cycling modes? What are your views regarding electric cycling, paddling cycling?
I think what I said before, cycling is extremely important for health.
We promote both.
Okay.
Yeah.
Go ahead.
Go ahead, Mirthe.
And especially for the elder target group, sometimes they are not, they can't physically paddle anymore. So if they use an electric bike and they can still keep on cycling, that's a huge improvement, and they can still be active and reach further distances than when they're not, when they can't cycle altogether. So it's important that they keep on cycling, and which bike they use. Yeah, I don't think that matters. Mm-hmm. I think that cycling is important, and if you can use a pedal bike, great. If you use an electric bike, fine. So both are okay.
Yes, indeed. You mentioned this, in your presentation, that it can help them cycling longer in their lives, and of course that brings many health benefits. So, and Mark, you were also mentioning.
Yeah, I think I agree there with Mirthe what she said, because we know that cycling is extremely important. It is good that reduces premature mortality. It's good for mental health, in particular around this time with the COVID pandemic. People get all anxiety, depression, and actually getting on the bike helps a lot for a lot of people. But a pedal bike is fine for normal people when you do short journeys or whatever you do. But what we've seen in our research is that electric bikes are particularly used by people that normally can't cycle on a pedal bike. I mean, I think what Mirthe was saying there, the elderly, it's important. They need to have some support. If you go to the Netherlands, you're lucky when you have the wind in your back. When you have the wind in front of you, it's much more difficult. You need an electric bike. We've seen it in places like where there are hills. I mean, that people are happy to cycle when it's flat, but as soon as they go up the hill, it becomes a bit more difficult. So if you have some support, some electric bikes, that's also important. So I think it involves other groups. I mean, the other thing what we've seen is that people use the electric bike more for long distance travel. So normally they would take the car, but now they can actually do a longer distance with their electric bike. And so it has many advantages, I think. My concern, the only thing is kind of about speed, because sometimes they go too fast, and that's been mentioned before. But, I see them, it actually opens up to a lot of people, it opens up the possibility to cycling. So I don't see it as bad. And I think the studies, what have shown it is that still people get about 75% of the physical activity of a normal bike when they have an electric bike. So it's not that bad in a way. Of course, it's not so good for your pocket because they're generally still quite a bit more expensive, but that's another issue.
Mm-hmm. Yes, and you also mentioned that they can have also a role in commuting or in longer distances. So
yeah, no, that's right. I mean, that, a normal bike, people commute between 5 or 10 kilometers or something. Electric bike can go over the 10 or 20, 30 kilometers. I mean, so that's a big advantage, I think. Unfortunately, what we've seen, like, for example, in Barcelona, that we, one of the big problems with, I think it hasn't come up, is that but like Barcelona is part of a metropolitan area, so a lot of people have to come by car into the city because there are no alternatives. I mean, what we need is better public transportation, but also, for example, cycling lanes through the whole metropolitan area. I mean, at the moment, it's not possible to commute from one city just in the metropolitan area to Barcelona because the cycling paths are not there. I mean, at the moment, there are plans to implement them, but this would be great for electric bicycling, for example. But of course, if you use a normal bike, you get a bit more physical activity, what would be even better.
Mm-hmm. Thank you very much. Let's go again to the poll to see how are the results. But yes, as mentioned before, we mentioned reducing car dependency and moving towards public and active transportation, improving collaboration, leadership, and investment with citizens. This is something that you mentioned in your Mark, in your presentation, but maybe you can also elaborate a bit more. And but promoting land use changes and having more compact cities. How does that affect health of citizens? If you can.
Yeah, of course, it's one of the most difficult things to do in a way that because the cities are as what we have at the moment. But the idea behind a compact city is that people travel shorter distances, and so they are not relying on the car, but then actually can use walk or cycle. So you have your destinations much closer. So I think how you would interpret it in the current way is to filling up space in the cities, make it a bit more dense for people to use, and that they can walk around. I mean, now, of course, what you may get is like, for example, like in Barcelona. Barcelona is one of the most compact cities in Europe. It's a nice city. I mean, it's 5, 6 high apartments. It's all quite nice, but unfortunately, how the streets then are used is not correct. I mean, originally, Ildefonso Sada, who designed the city, was imagining to have this compact city. Everything was close, walking distance, wide streets for a lot of fresh air. But then in the 60s, the cars came in and they caused a lot of air pollution and also noise, and took up space that could be used in a much better way, for example, by greening. And so that's what we're trying to reverse with the superblocks at the moment. And that's one of the challenges. I think you want to have a dense city, but not too dense, because you also want to have green space there. And then also how you use that little space that you have left. How do you use it in the most efficient way? And by allowing the cars in, that's not the most efficient use of space. So that's why you're looking at modes that use up much less space and are more sustainable.
Mm-hmm. Yes, that's a very interesting point, and also mentioned by Dorrith before, how the cities were designed first for humans, then they were designed around cars, and now we're doing the effort to put again citizens in the center of the design. And you also mentioned greening, and in some of your research, you say that greening has many health benefits, including longer life expectancy, fewer mental and health programs, better cognitive functioning, better mood, and furthermore, it mitigates air pollution, heat and noise levels, which all have health benefits. So from your practical experience, Dorrith, of moving away from cars and doing this kind of experiments, also bringing more green areas to the cities, what would you recommend to other cities that are also in this path and are implementing similar measures?
Yeah, well, I would recommend to really show, make visible what you get in return for reducing cars. So what we did during the experiment in the Hoogkwartier, we literally turned one parking space for a car into a little area of green. And people in the neighborhood and visitors, they said they really appreciated that. So literally turning the space around, and you can see the result, and you can see how big one car park space is, for example. So that's what I would recommend, to really make visible what you get in return for getting rid of your car. And also, well, in Rotterdam, actually, we have the issue of water management. So green, not only for against air pollution, or like for attractive places, but green is also vital in our water system, because when it is raining really hard, our sewers cannot process the amount of water, for example, in the city. So adding more green will help our sewer infrastructure. So that's like a really practical reason why you need to add more green and make it healthier in the way of water management.
Mm-hmm. Yeah, very interesting, and sometimes not that evident. So very interesting connections. I have another question for Mark from Lucia Cristea. Is there any evidence for the internalization of the trips based on the superblock concept?
What's meant by this internalization?
Maybe Lucia Cristea can, if she wants, ask for the floor and can join us in the panel to ask it. If she wants, otherwise.
The trips more local. That's what we're hoping for. Yeah, that you get more local trips rather than trips across the city. I mean, I think what it mainly does is the superblocks is reduce the space where people can travel. I mean, one of the big problems is that there is still a lot of cross-city traffic around Barcelona, and actually we need to reduce that. And by reducing the space for cars, they can't go to these particular areas. And hopefully this will also lead that people stay more locally and enjoy their own neighborhood.
Okay, thank you. If Lucia needs further clarification, please let us know. Okay, so, well, we have only a few minutes left. So yes, for example, Stuart, if you would like to speak, to recommend something to cities that are here today and are, how would you encourage them also to start collaboration and those practices that you are working on right now? What would you recommend?
Well, thank you. Yeah, so there will be existing channels through which your relationship will currently be set up, and trying to identify where those channels exist and exactly how they operate. That would be a great starting step. Mapping that out and seeing what is being done, and then finding out what isn't being done, addressing the research that's out there, tons of it, and innovative programs which are being adopted across the continent, across the world. And just finding the right people through extensive stakeholder mapping procedures would be a recommended example of how to start that engagement, I would say. It's been a bit of a tricky time because the priorities at the moment, as you might suspect, are with COVID-19. But then we actually used this to our advantage because it had actually created a bunch of other relationships, a bunch of other working groups. And so if your city has experienced that kind of operation, then trying to tap into that as a vital resource would also be an approach that I recommend. So have a little look around, ask around your mobility teams and around the health teams, and see if you can exploit those existing channels and enhance them in that way.
Thank you very much, Stuart. And you mentioned also the impacts of COVID, and Mirthe was also mentioned in her presentation how COVID had impact the habits of older people when cycling, and how which repercussions did it have, and how did you handle this? Could you elaborate a bit on this?
Well, what we saw was lockdown started in March in the Netherlands, and at first the numbers of cycle and walking increased rapidly. It went very high, very fast, and even the bikes sold there was a shortage of bikes in short. And for us, the main question now is, how do we keep on to that? How do we ensure that people keep on walking and cycling and do not get back in their cars? Because COVID also created the momentum, which has benefits for active mobility. So we want to keep hold of that. And for elderly people, it's also a tricky time because they're scared to go outside. They want to stay inside their safe bubble. So how do you keep them fit? How do you provide them with information about safe cycling while they're scared to go outside? So we work together with a professor here in the Netherlands, with a local TV programs to reach these elderly people at their homes. We gave them information on how to stay fit at home. So we did exercises with them via webcam sessions, etc. So we had to be creative, and it's a different way of reaching people. But we hope that this also showed that behavioral change can take place, and it's COVID has made that very clear. So we're not tied to our cars or public transport. We can actually cycle and walk more. And I hope that we can keep hold of this change.
Hopefully, yes. Thank you very much, Mirthe. Well, yes, I think we can conclude that better urban and transport planning can lead to carbon neutral, more livable and healthier cities, particularly through strategies such as the ones we have seen today, including moving from private motorized transport to public and active transportation, through the promotion of cycling, greening of cities, land use changes, promoting cross-sectoral working, and many others. I want to thank the speakers for your valuable contributions. I think they have been very insightful and hopefully also served as inspiration for other cities. Thank you, Claudia, for her support in the chat, and thanks a lot to the audience for engaging in the chat and for your time. I hope you could take something valuable from this session. And if you have questions, don't hesitate to get in touch. We wish you a great conference. Remember, you can visit the exhibition area and the networking area, which is quite fun. You can visit it after the session. And thank you all. I hope you enjoy the POLIS conference. Thank you.